Good afternoon, my name is Charmin Herrera with student number 1453-73239, and I'll be doing a video presentation on neurological and musculoskeletal assessments. Here is my one card, and please do 360 for me. Thank you. Perform hand hygiene, check room for contact precaution, provide patients privacy by closing the curtain. Hi, my name is Charmaine and I'm your nurse for today. I'll be conducting a neurological and musculoskeletal assessment to check your nerves, movement, and reflexes. Is that okay?
Yes.
So may I confirm for your complete name and birthday?
Krisha Uy, January 1, 2000.
So thank you, Krisha. In this assessment, I'll be asking a few questions and perform some tests to check your reflexes and movement. So is that okay?
Yes.
So can you please state your name again? Where are you today and what date today?
Krisha Uy, Emergency Room, March 27, 2025.
Thank you. Do you have any recent fall or any head injuries like
No.
seizure and headache?
No.
Are you taking any medication for pain, joint pain, and muscle pain?
No.
Do you have any medications before you come here? Do you take any medication?
No.
Or do you have any problem with the movement?
No.
Okay, so thank you. So patient is oriented to time, date, and place. Patient is coherent and he is well groomed, and speech is well articulated and no facial drooping noted. Now I'll be checking your, can you walk back and forth for me please? And can you bend for me? I'll be checking your spine. So thank you so much. Patient's movement is symmetrical and spine is straight and no scoliosis and no lordosis noted. Now I'll be checking your cranial nerves. So let's start with cranial nerves 3, 4, and 6, which is the oculomotor, trochlear, and the abducens. So please follow the movement of my hand without moving your head. So I'll be checking your pupil. Good. Okay, pupil are equally round and reactive to light and accommodations, and patients move towards the movement of my hand without any difficulty. So now I'll be checking your trigeminal cranial nerve 5, which is the trigeminal nerve. So can you close your eyes and please tell me what senses are you, what area of the face?
Forehead, left cheek, chin, right cheek.
Okay, so can you open your mouth, cleanse your teeth, open your mouth. Okay, thank you so much. So trigeminal or cranial nerve 5 is intact and with no the trigeminal nerve is intact. Now I'll proceed to the cranial nerve 7, which is the facial nerve. So can you smile for me? Frown. Can you raise your eyebrow? Can you puff your cheeks? Okay, you said facial movements is intact. And now let's proceed to cranial nerve 8, which is the vestibulocochlear. Can you cover your right ear and follow what I say? Philippines. How about your right ear? Can you also follow what I say?
Canada.
Okay, so cranial nerve 8 is intact and the patient hears what I say. Now let's proceed to cranial nerve 9, 10, and 12, which is the glossopharyngeal, the vagus nerve, and the hypoglossal. So now can you close your eyes? Can you move your head up and down? Can you open your mouth, move your tongue upward, downward, sideward? And can you open and say ah? Okay, so cranial nerve 9, 10, and 12 is intact. Swallowing is present. Gag reflex is intact. Ovularises and the tongue is in the midline. Now let's proceed to cranial number 11, which is the accessory. So can you accessory muscle? Can you move your head upward? How about downward? How about your shoulder? Then downward. Okay, cranial nerve muscle, cranial nerve 11 is intact and the head and shoulder can move back and forth without any difficulty. Now I'll be checking your upper extremities and your range of motion. So can you raise your hand? Right hand, right foot. So can you fight against me? Okay, how about this one? Okay, so the color of the skin is appropriate to his age. movement is not restricted. Did you feel this one?
Yes.
Sensation is intact. Can you grip with three times? Hand grip strength is 5/5 with a score of 5/5 and strong. So can you capillary feel of less than 2 seconds? Now I'll be doing the range of motion. So can you put your neck and shoulder? So first we'll do the neck and shoulder. So can you bend your neck? That is flexion. How about extend your knees? Extension. Can you tilt your head? That is lateral flexion. How about move from right to front? Okay, that's rotation. Now can you move your shoulders inward? That's internal flexion. How about upward? External flexion. And then can you raise your arms? So can you towards you? Can you move your head towards you? That's flexion. How about this one? Can you follow what I'm doing? Extension. Can you move your right hand away from your body? Right hand. No, this one. Right hand. Okay. That's abduction. How about close? That is adduction. How about the other one? Okay, that's abduction and adduction. And then, can you point your wrist? Can you do your hands like this straight? So this is supination. And how about pronation? And then can you palm towards up? That is pronation. So can you go back again to pronation? Then you lower your wrist. That is flexion and then up. That is extension. And then can you point finger towards your thumb? That is radial deviation. And then how about towards your pinky finger? That is ulnar deviation. Now I'll be checking your lower extremities. Can you lie down first? Thank you. So I'll be checking your lower extremities and your range of motion. So skin is warm to touch, color is appropriate to ethnicity. Can you raise your right foot? How about your left foot? Okay, your movements is not restricted. Did you feel this?
Yes.
Sensation is intact. Now I'll be doing the range of motion. Can you raise your feet? This is flexion, and then can you extend? How about the other one? Okay, it's flexion and then extension. Can you move right foot away from your body? That is abduction. This is adduction. How about the other one? So it's abduction and this adduction. Now can you bend your feet 90 degrees and then put it inward? This is external hip rotation. How about this one? This is internal hip rotation. How about the other one? Can you do it? Bend your knees 90 degrees and then flex it inward. This is external hip rotation. How about downward? That is external hip rotation. Now I'll be checking your flexion. Can you point your toes towards your nose? This is dorsal flexion. How about, okay, this plantar flexion. So again, can you do it and then fight against me? Okay, how about this one? Okay, so plantar flexion, dorsiflexion is strong and the score of 5/5 and strong and equal bilaterally. So can capillary refill of less than 2 seconds and is equal. And now that is the end of my neurological and musculoskeletal assessment, and thank you for your time. Thank you. Do 360 for your day.